Good afternoon. I'm Alan Unell, and this series of videos is called Healthcare Reform Advocacy, where we address problems in the healthcare system, take actions, and those actions try to make the system better for all of us. We have a number of topics today, but before we get to them, I want to point out that down below in the description box will be a link to the Healthcare Advocacy Newsletter, which is a mostly daily newsletter, that is the text for this video, and all of the links to stories and references, everything is in there. Okay, so let's start. Medical debt and credit reports. A little while ago, we reported that the Biden administration was seeking to remove medical debt from credit reporting. Hopefully that will occur next year, and that'll be a big benefit for consumers. However, just this week, it was reported that the share of American consumers with medical debt on their credit report has significantly declined over the past year because major credit rating agencies are removing small unpaid bills and debts less than a year old. This analysis was done by the nonprofit Urban Institute. At the same time, millions of Americans now, as a result, see their credit scores improving. And that's going to make it easier to get jobs and rent an apartment or get a car or get a mortgage. So that's great news. Okay, offer help early. Now, here's a program that's a start in the right direction, and we'll take anything that's a step in the right direction. A few weeks ago, Senator Bernie Sanders of Vermont introduced a report that he had done into the Senate, and what he detailed was how tax-exempt hospitals were failing to offer significant charity care, even while they took in billions of dollars and paid their CEOs millions of dollars. These are tax-exempt charities. Okay, most of the 16 major systems that he investigated offered 2% of less of income to pay patient bills. Now, a new Minnesota law is going to require hospitals to check if patients are actually eligible for financial assistance before they refer medical debt to collections. Me personally, I think they could do it on check-in, but okay, take anything. It's a move that supporters of the change say will ensure that many people will find out what help is available, and it may relieve the burden of steep healthcare costs for many. The provisions took effect this last Wednesday, so that's great. This next story is not good news. Infant mortality is on the rise for the first time in 20 years. The number of American babies who died before their first birthday rose last year, significantly increasing the nation's infant mortality rate for the first time in 20 years. This is according to some provisional figures that were released this past week by the National Center for Health Statistics. That's, of course, a government agency. There is a link to their report and a link to a New York Times story where this was reported. And I should say, there's a friend of ours, Mary, who's a physician and a subscriber to this newsletter, who pointed out the report to us. The increase in infant mortality comes after a century of public health improvements in which the rates consistently and gradually declined, the death rates, almost every year with very few exceptions. The provisional number of linked birth infant deaths for the United States in 2022 was 20,538. I had no idea it was that many. And that's an increase of 3% from 2021 when it was 19,928. The provisional infant mortality rate for 2022 was 5.6 infant deaths for every 1,000 live births. Okay, the rates jumped from 2021 to 2022 for white, Hispanic, Native American, and Black women. For white women, the rate was 4.52 deaths per 1,000 live births. For Black women, who had the highest death rate, it was 10.86 deaths for every 1,000 live births, more than double the white death rate. Don't tell me there's not a race problem. Okay, when considering the ages of women, this was also incredible. The only group that's experienced any significant increase were infants of women aged 25 to 29, where it increased from 2021 to 2022 from 5.15 infant deaths per thousand to 5.37. Leading causes of death, of the baby's deaths, were maternal complications and infant sepsis. Remember, this includes death after birth all the way out to the first year. The National Center for Health Statistics also provided a map, and there'll be a link in the newsletter. You can click on it and go to the map, and you can see what's the infant mortality rate in my state. They have it updated up to 2021. And it's a little shocking because states that are known to do things like ban abortion and whatnot, in general, have some of the highest infant mortality rates in the Southeast United States. The NCHS, the Health Statistics Group, identified no clear causes for the increases in the report. There may be a relationship to the pandemic, possible, because people use telemedicine then, as opposed to office visit. There may also be a relationship to the sweeping abortion bans in 24 states. I'm sure they're going to have significant further investigations because this type of statistic is actually a very serious canary in the healthcare system coal mine. Now look, there's going to be an action, and I will print it separately outside of the newsletter for you to take. And what it is to contact the National Center for Health Statistics, thank them for the report. It's a good report, and of course the link is in the newsletter, and ask them to continue the investigation to figure out what the root causes are of the increase in infant mortality. Because once you know what the root causes are, then you can figure out how to improve the healthcare system and save children's lives. Okay, that'll all be down below. That's what we have for you today. Down below, like, share, subscribe to Healthcare Advocacy's newsletter. Have a good afternoon.